Hey y'all, our first disease is bronchiolitis, and this is a lower respiratory tract infection and inflammation of the small airways, which is the bronchioles. And this occurs in infants and children under 2 years old, and it is a complication from RSV.
Okay, so what are the signs and symptoms of bronchiolitis? So first, you want to notice that there is going to be a fever of 101 degrees Fahrenheit. If not, it's going to be higher. And then first, you'll have upper respiratory systems. This will last for 1 to 3 days, so really make sure you keep track of that. You'll notice nasal congestions and then rhinorrhea. After this, it's going to be followed by lower respiratory tract infection, because whatever starts up here is going to eventually come down here. And this will happen typically on day 2 to 3, and this can cause respiratory distress, so you really want to make sure you keep track of this. You'll definitely notice a cough and labored breathing, and this is going to be important for the duration, as far as duration of symptoms and signs. It's going to be 7 to 10 days, and we'll kind of go over that for patient education. Now, for physical examinations, when you're going to do your physical exam, you're going to notice crackles in the chest when you're osculating. You're going to notice wheezing, bronchi as well, and then there's going to be some retractions as far as in the chest, and the severity will vary depending on how much they're struggling to breathe.
So there are no specific diagnostic studies for bronchiolitis. However, it is a diagnosis based on your clinical findings, based on patient presentation as well as your physical exam findings. However, a good tool to use to assess your disease severity is going to be pulse oximetry, especially in your children.
Okay, so now for the bronchiolitis treatment, we have Mr. right here who's going to be helping us. We're going to do supportive care. So this is where patient education comes into play, telling them that their symptoms will last 7 to 10 days, and we'll be using all these supportive care treatments just to help them feel better. So that's like rehydration, relief of nasal congestion, oxygen through a nasal cannula, and then antipyretics like acetaminophen. So if you have an infant with a more severe case who's hospitalized, they'll be getting aggressive rehydration, humidified O2, and then nebulized hypertonic saline. And then only if patients have RSV, they'll get the RSV vaccine, and this is also given for severe hospitalized patients and then for immunocompromised patients as well. So complications of bronchiolitis. So this is dehydration, respiratory failure, aspiration pneumonia, apnea, and then secondary bacterial infections like otitis media, and that's the most common one and important one we see.
All right, guys, so this is going to be our second disease. This is pertussis. So first off, what is pertussis? So pertussis is a very highly contagious acute respiratory disease that's also known as whooping cough. The epidemiology is prior to vaccination, greater than 90% of cases were going to be in children that are less than 10 years old. However, since about 2015, there's been an increase in cases for the 11 to 19 age group, as well as a cyclical appearance or epidemic every 2 to 5 years. And cases have been continuously on the rise since 1970. The etiology, it is caused by the Bordetella pertussis bacteria. So moving on, signs and symptoms. So our signs and symptoms are broken up into 3 distinct phases. The first is the catarrhal phase, and that is denoted by our sneezing, coryza, anorexia, malaise, as well as a hacking night cough. This lasts approximately 2 weeks, and during this time, the patient is extremely contagious. After that, you get the paroxysmal, and that is annotated by rapid consecutive coughs followed by a very deep, high-pitched inspiration known as a whoop, which is where it gets its name, whooping cough. This lasts for 1 to 6 weeks, and they're very contagious during the first 3 weeks, with the infectivity falling off around the end of that time. After that, you have the convalescent period, which begins approximately 4 weeks after the start of the illness and the symptoms, and it's annotated by a decrease in the severity and frequency of the rapid consecutive coughs along with a whoop, and the total duration for this disease is going to be about 3 months long.
Okay. So physical exam really is based off of what phase the patient presents in. And then for prevention, so for pregnant women who have not received the vaccine before, they're going to need to take the whole DTaP series vaccine. And then for infants, it's recommended that all of them get it. This is based off the CDC guidelines. And then for pregnant women who have previously been vaccinated with the DTaP vaccine, they need to receive a booster in the early part of the 27 to 36 week range of gestation. So for patient education, you just want to educate on why infants need to get this vaccine and the different phases for women who are pregnant, whether they have gotten it before or if they haven't gotten it at all.
Okay, so for diagnostic studies, what are we gonna do so we can differentiate everything? So you're gonna do lab work. So first we're gonna do blood work. So that's gonna be a CBC with differential. Differential is essentially they're going to be looking at the which white blood cells are present and then kind of comparing from there based on the levels. So 60 to 80% of patients will present with lymphocytosis, and this is usually unusual in bacterial infections except for pertussis. So pertussis will essentially release a toxin that increases T cell proliferation and blocks them from entering the respiratory tissue. So lymphocytosis is not specific for diagnosis though, but absence can make pertussis less likely, so just keep that in mind. And then for microbial confirmation is needed for definite diagnosis. So you're usually going to do a nasopharyngeal swab or blood draw. So this usually depends on which phase the disease is in. So if you're in the first or second phase, you're going to be doing a Dacron or Rayon swab. But if you're in the last phase, because they're not going to be contagious, you're going to be confirming with a blood draw.
All right, so our treatment is going to start with supportive care, acetaminophen, NSAID, supplemental O2 if needed, and then we're going to go into antibiotic treatment. Our antibiotic of choice, the class is going to be a macrolide. Our first line choice is going to be erythromycin, 500 milligrams, 4 times a day for 10 days. Second up is going to be azithromycin, 500 milligrams by mouth once a day for 3 days, and then lastly, clarithromycin, 500 milligrams by mouth twice a day for 7 days. Close household contacts and also high-risk contacts that are outside of your household also should receive a prophylaxis antibiotic regime, either erythromycin or the azithromycin. Some complications. So hospitalization is indicated for the following complications. So we have our superimposed pneumonias, we have hypoxia, we have our CNS complications, the inability to hydrate, as well as being unable to tolerate nutrition.
Okay, so these are the differences between bronchiolitis and
Pertussis.
so the etiology for bronchiolitis is RSV,
For pertussis, the etiology is going to be Bordetella pertussis.
and for bronchiolitis, this affects infants and children under the age of 2.
For pertussis, it's going to be affecting all age ranges.
And then for the signs and symptoms for bronchiolitis, it's going to be for the upper respiratory tract infection and the lower respiratory tract.
While for pertussis, so it's going to be changing once again depending on the phase, and biggest thing is that you're going to hear that whoop.
Yes, and then for bronchiolitis, the diagnosis is based off clinical observation.
For diagnosis for pertussis, it's going to be microbial confirmation.
And then the treatment for bronchiolitis is just supportive care.
While for pertussis, treatment is going to be antibiotic.
All right, so the similarities between pertussis and bronchiolitis is going to be they're both respiratory infections, they're both spread via droplets, and are both highly contagious. They both present early with signs and symptoms of URI, cough, dyspnea, mild fever to afebrile. They both require supportive care, and they both have vaccinations available. Thank you so much for listening.